I had exposure to medicine at an early age. My grandfather, my mom's father, had glaucoma. And so growing up, whenever we went to visit him every year, he would wait until I got there to go to his appointments. So it became one of the sort of things that we would do while we were in India. I would take my grandfather to his appointments. And so from a young age, probably starting around when I was 6 or 7, I would have exposure to these clinics. I would help administer his eye drops. I would hold his hand and help him get into the car and then out of the car when we got to clinic, things like that. So yeah, I mean, I had exposure at an early age, and when it came time to think about my profession, I had already given a lot of thought to ophthalmology, and it seemed like a natural fit for me. I enjoy helping patients, enjoy helping them see better, and it was a perfect fit for me. As early as my first year of medical school, I was able to come over here and help out with a few research projects. And back then, I remember meeting Dr. Spaeth. He was a very serious academic physician, and luckily he took me under his wing and really helped me develop as a physician, but also as a person. Anyone who knows Dr. Spaeth knows that he is more than just a physician. He is just the whole package. And so I was very fortunate to have him as one of my first mentors. And after working on a few projects with him, it became clear that ophthalmology was the specialty for me. The first project I worked with him on was a project where we looked at whether listening to Mozart music might help a patient as far as their reliability when taking the visual field. And it was interesting. We spent months and months collecting data. I think I interacted with about 100 patients, helped administer their visual fields, and then collected all the data. And after all of that, we found that there is no effect. And that was disappointing to Dr. Spaeth. But through all of those drafts and data analysis and working closely with Dr. Spaeth, it just became clear to me that this kind of specialty, when you have the ability to interact with patients on this level and collect this sort of data that can actually have a meaningful impact on how we run clinic, it became clear that this was the specialty for me. So within ophthalmology, I've chosen my subspecialty as glaucoma. Glaucoma is very important to me. As I've mentioned before, I used to help take my grandfather to his appointments, and it's one of those specialties where I could see that the glaucoma specialist really knew my grandfather, even though he didn't see him all the time. But that longitudinal follow-up, you really get to know your patients, and that's something that I really looked for in a specialty. I wanted to be able to get to know my patients, and there are few specialties like glaucoma where you get to know the patient, you get to know their family, because you're not just treating the patient, you are treating their family. Often they'll bring siblings or kids or grandkids with them, and these are the folks who actually administer the eye drops, keep track of some of the schedules for some of the patients, and so it's a unique division of ophthalmology where we really get to know the patients longitudinally. I was very fortunate to train at Wills Eye for residency. It's a special program. The residents here truly are family. We learn together, we learn from each other, we teach each other. And as an attending now, coming full circle, it's been amazing being able to interact with residents, staffing cataracts, teaching surgery, learning in clinic myself. Often I'll be interacting with the resident and learn things from them in a way that isn't possible everywhere. So you kind of get the best of both worlds here at Wills. You treat your own patients, but you also treat patients alongside the residents, and it's a learning experience for everyone. In my spare time, I really like to run. I swim. And I used to do triathlons and marathons. I'm slowing down on that end a little bit. It's been great being back in Philadelphia. I spent a year down at Duke doing glaucoma training, but now I'm back, and establishing my practice and looking forward to meeting people and treating this community.